In previous videos, we've talked about how social distancing can mitigate the spread of COVID-19, but what about scenarios where this is difficult to enforce? This is where masks can save lives. Let's look at a day-to-day scenario we're all familiar with, shopping at the grocery store, where social distancing is difficult to enforce and there are a lot of close interactions with other shoppers. For simplicity, this animation portrays a single infected person walking through a grocery store with the other shoppers standing still. Let's see how many people become infected after this one trip to the grocery store. Only the initial person can infect others, as the people who become infected are not immediately contagious. Also, given the short time we're looking at, no people will recover or die from the disease. At the end of this trip, 23 people were infected. Let's look at how this kind of spread plays out on a longer timescale, where people who are infected eventually become contagious. This simulation shows 1,000 people with 1% initially infected. The peak of the curve shows 55% of the population is infected at once, and at the end, 149 people have passed away. How can we reduce this spread? Our last video covered social distancing, but when that is challenging to maintain, wearing a mask can be significant. This time, only the infected person wears a mask, which reduces transmission. At the end of the simulation, only 10 people were infected. Now let's look at one more simulation, where half of the shoppers and our sick person wear a mask. Even fewer people become infected. Only 4 people became infected. That's a huge improvement. In real life, we don't always know who is infected, so it's important that everyone wears a mask. Although masks are more effective when worn by contagious people, they still are beneficial when worn by everyone. This longer simulation shows how infectivity and mortality are affected by how much of the population wears a mask. The first panel shows the initial model where no one wears a mask. The next has 30% of the population wearing a mask, followed by 50% and 70%. As the fraction of the population wearing the mask increases, the peak of infectivity decreases. This is what is meant by flattening the curve, which can help limit the strain placed on hospitals and healthcare professionals. The number of deaths also decreases with increased mask wearing. Masks are another tool for mitigation of disease. How many people wearing masks and the type of masks play an important role in reducing spread. N95 and surgical masks are better at reducing the spread of disease, but even cloth masks are beneficial. Thanks for watching. We hope you stay safe.